Over the last 6 weeks, I've conducted research on how ADHD plays a role in how a child conducts themselves in an academic setting and what alternatives can be added to their unique curriculum to ensure better success. Whether a young student has been diagnosed with ADHD or not, the implications of how they are affected are the same. ADHD is a hindrance to the way an individual can focus on a given task and how they articulate their emotional intelligence. I've studied 3 different practices that have proven to be successful to help alleviate ADHD symptoms to promote better classroom success. The first is implementing the services of a reading interventionist to help with a child's ability to learn methods to master the skills of reading fluency and comprehension. These are 2 areas that students with ADHD are more prone to struggle with. The second alternative to alleviate symptoms, which focuses on emotional intelligence, is alleviating conflict between the ADHD student and teacher parties. According to Rushton, who is one of the individuals that I extracted research from, conflict between a teacher and a student stricken with ADHD will diminish their engagement in the classroom. My last area of focus is to observe the implications of having ADHD diagnosed students participate in daily exercise and tracking their exercise in a Mobilize app. There was a correlation between the alternatives of physical activity and utilizing mobile apps to track exercise daily. By participating in this structured plan, students were observed to be engaged in the activity because their focus was brought to a higher level. One of the people that I extracted data from was Dolu, and he was the one who was able to make this correlation between physical activity, the Mobilize app, and ADHD diagnosed students. My plan is to link the 3 above practices from Rushton, Dolu, and Denton and bring them into fruition by monitoring how well a child with ADHD learns fluency and comprehension with the assistance of ADHD medications and a reading interventionist, placing them in an environment where conflict will be completely eliminated, and having them practice an organized recess, utilizing mobile apps to track their exercise to observe whether or not they perform better in the classroom, learning the above mentioned reading skills. So essentially what I'm trying to do is, yes, ADHD medication is extremely important and can definitely benefit a child, but I'm trying to find other ways, based on the research from Denton and Dolu and Rushton, that will be non-pharmaceutical ways to help them manage their ADHD symptoms and have better results with reading comprehension and fluency in the classroom. A quick overview of the data that was used to create the action plan. I used the premise of document method research from 3 main sources to ensure enlightenment on the subject. As stated earlier, this is mainly from Rushton, Denton, and Dolu. My proposed action plan requires me to randomly divide ADHD diagnosed children in a lower elementary class into 2 groups. One group will receive assistance from a reading interventionist, participate in organized recess while tracking their exercise using a Mobilize app, and be in a classroom where their interim ELA teacher will be educated on how not to engage in conflict and have knowledge on how to dissipate it if it were to arise from a student. The second group will be participating in normal everyday activities. So the second group will be seen as more of a control group, whereas the first group will be the one receiving the different services and the different schedule changes. The only time period where they will be participating in synchronous activities will be at the very beginning taking a pre-test and the end taking a post-test. This study will take approximately 35 days. The research produced by Denton supports my rationale that students with ADHD will perform better with the assistance of a reading interventionist when it comes to mastering fluency skills. There are 3 groups in this specific study. Group 1 received ADHD medications only. Group 2 received assistance from a reading interventionist alone, and Group 3 received combined treatment implications. So they received the ADHD pharmaceutical methods to alleviate symptoms, but they also, Group 3, received help from the reading interventionist. When it came to testing phonemic awareness and fluency, the children grouped in the reading interventionist group only, this was Group 2, and the combined ADHD treatment and reading interventionist group, Group 3, they outscored Group 1 in their post-test following the study. This knowledge correlates with the fact that students who have inherited ADHD are more likely to struggle with reading fluency due to the fact that they obtain restricting abilities with maintaining attention and working memory in the sense of verbal means. Being able to read with high phonemic awareness and fluency will help with comprehension since a child is able to read the material successfully. So this is why in my study I would like the help of a reading interventionist with these students who are struggling to manage their ADHD and have struggles with learning the skills of reading, fluency, and comprehension. That is why I want them to be with the reading interventionist, and I want the reading interventionist to be groomed to be able to help them achieve higher scores in these areas. Moving on to Rushton's research, this meets my criteria of rationale by conducting the effectiveness of not having teacher-student conflict within the classroom and observing enriched engrossment and engagement in the material taught in the classroom when conflict is non-existent. It has been noted that children suffering with ADHD does not have an effect in how well they engage with the material and lessons given by their teacher. So what this is saying is just because a student is diagnosed with ADHD or they display symptoms of this ailment, that does not mean they're going to automatically be disengaged in class. The big factor is conflict between the two parties, from the student and from the teacher. That is what causes disengagement according to Rushton. However, conflict between the teacher and the student struggling to manage the ADHD does play a prominent role in how strongly committed they are to learning new material. Lastly, Dolu's document method of research is appropriate for my research rationale in respect to the component of intertwining physical activity and mobilized apps. It was noted in the above study that children with ADHD have been projected to experience the implications of boredom more than a child who does not have this ailment. By tracking physical activity with the mobilized app, the children in the study were required to maintain heightened focus when using the app while they were engrossed in physical activity. Their senses were constantly alert, which allowed them not to experience boredom. Not only does physical activity improve symptoms related to ADHD, but using an app to trace their exercise improves their symptoms and allows them to think in a more cognitive manner. After analyzing the above research from Dolu, Denton, and Rushton, I believe my proposed plan will prove that using a reading interventionist for assisting ADHD diagnosed children, participating in organized recess using an app to track their physical performance, and proactively eliminating conflict between teacher and student parties will ensure the students in Group 1, in my study, will perform higher on their post-tests since they are receiving an ELA curriculum more tailored to their needs. Moving on to each role that the stakeholders will play in the action plan and the timetable, there will be 3 important stakeholders in my study to help produce the best research for the above action plan. These 3 individuals will be the reading interventionist, the principal, and the researcher, which in this case, I will be the individual conducting the research. So in this study, I will be a stakeholder as well. The reading interventionist will be implementing a strategy similar to the one presented by Denton. The main difference is that there will be 2 randomized groups instead of 3. The reading interventionist will be assisting Group 1 with fluency and comprehension, but not Group 2. They will also act as an ELA instructor to Group 1 and ensure there is no form of conflict coming from their side. If conflict arises from a student, they will be prepared on how to alleviate it. Group 2 will be with their usual ELA teacher who will not be instructed to avoid potential conflict. The next stakeholder will be a principal enforcing professional leadership. They will ensure FERPA, CIPA, and COPPA are withheld to protect students' privacy. The principal will be responsible for keeping the written consent of the parents that acknowledge the implications of the study and have allowed their child to participate. Lastly, I will be a stakeholder as I will be analyzing the data collected. In regard to observing the link between physical activity and utilizing mobile apps, I will be administering the apps and designing an organized recess plan to the students in Group 1. Group 2 will act as a control group. Since they will not be exposed to ADHD medications, a reading interventionist, nor organized recess, In conclusion, I will be analyzing the differences between Group 1 and Group 2 in regard to how well they learn fluency and comprehension, whether or not the exposure to organized recess with mobilized apps is effective, whether ADHD medications will alleviate symptoms, and lastly, if the use of a reading interventionist will help promote better reading success for each student. The amount of time I believe to be the most effective for my study is a 35-day period. I would like to start it on the first of the month at the middle of the school year after Christmas break. By starting in January, the students will have had an entire semester and I will be able to observe clearly what reading benchmarks they have achieved and what reading level they are on. Another reason the middle of the school year will be most effective is that there will be a larger population of ADHD students to study, since there is a chance they have been diagnosed after the year started and can act as participants in the study. The first 5 days will allow the students in Group 1 to become familiarized with using the mobilized applications. When I begin my research, they will know exactly how to use the given app to track their exercise during organized recess and be more self-sufficient. The first 5 days before beginning will also get the participants in Group 1 a lot of time to become acquainted with the reading interventionist, who will also act as their ELA instructor during this period of time. Following the introductory period, I will begin my research by implementing 15 minutes a day of organized recess for the students in Group 1. They will be following a structured exercise regimen approach for their age and have allotted time to track their activity. This will be a process that occurs daily for the remainder of the study. In regard to the assistance with a reading interventionist, both Group 1 and Group 2 will participate in a pre-test to ensure the stakeholders know what reading level they are currently on. Group 1 will be the only participants meeting with the interventionist for the remainder of the study and receiving services from her. The children will remain in contact with the reading interventionist for the amount of time ELA classes last, which is about an hour and a half. Group 2 will remain in their regular class for ELA and not receive assistance from the reading interventionist until both groups are administered post-test to observe their reading fluency and comprehension. The expected outcomes and benefits to the organization and the stakeholders are so many. Based on my document research, I am anticipating Group 1 to perform better than Group 2 in the post-test, targeting reading fluency and comprehension. The reason being is that they will be in an environment that has been studied to produce better outcomes for students with ADHD. The study produced by Denton indicated the truth that children with ADHD do suffer struggling with skills of comprehension and fluency in reading. After observing the data collected by the above researcher, it is clear that the help from a reading interventionist is necessary. Group 1 will be receiving assistance from a reading interventionist, which leads me to believe this will be beneficial to this group's success in reading curriculum as a whole. I am anticipating success in Group 1 as opposed to Group 2 because they will be participating in daily organized